Yes.
Alright, thank you. My name is Pauline. I'll be your student nurse today. Can I have you confirm your name, date of birth, and if you have any allergies?
Lauren Schilling, November 19th, 2002, and no, I don't have any allergies.
Okay, good. It looks like there's no allergies here. So I'm going to be doing a head-to-toe assessment today, but first, can I have you tell me what brought you here?
I hurt my wrist.
Okay, and can you tell me where you are?
I'm in Concordia Hospital.
Okay, and what is the next upcoming holiday?
That would be Valentine's Day.
Okay, and the president?
President Trump.
Okay, and so you're alert and oriented to person, place, time, and what year is it?
2025.
Okay, so alert and oriented times 4. Can you tell me a little bit more about your wrist? When did you first hurt it?
I heard it yesterday.
Okay, yesterday. What time?
Probably afternoon.
Okay, what were you doing? Sorry.
Just fell. Yeah.
Oh no. So how's the pain from 0 to 10? 0 being the no pain at all, and 10 being the worst.
I'd probably rate it about a 6.
Okay, and is it tolerable for you? Have you taken any medication, or what makes it worse?
It makes it worse putting pressure on it, but I've just been icing it right now.
Okay, does that help?
It helps a little bit.
Okay, so if you'd like, what is tolerable for you? And I can talk to the doctor.
Probably about a 3.
Okay, maybe we can give you some medication if you'd like for that. And I'll stay away from your wrist for now, but I'll continue with the head-to-toe assessment, beginning with your head. So I already washed or sanitized my hands, so I'm gonna put some gloves on. Okay, so I don't sense any abnormal speech or movement. So now we're gonna go with the top of your head and move down. And if anything hurts or is uncomfortable, just let me know and we'll stop with the assessment. Okay, so there's scalp. I don't see any dandruff or lacerations. I don't feel any nodules. And your hair looks good. No, doesn't look like any alopecia or balding. Okay, I'm gonna touch and check your temporal pulses. Okay, can I have you open your jaw? Alright, and then take a look inside. Looks good. Okay. Thank you. Alright, the look moist, pink, free of any lacerations. I don't see any cavities. Thank you for sticking out your tongue. Tongue looks good, free of any fungus or anything. Looks nice and clear. And now I'm gonna actually check your pupils. So if I can have you take a look from the back of the room. I'm just gonna bring the light over here. Okay. Okay, both pupils look equal, round, and reactive to light. And so I'm gonna check accommodation. You can keep your eye on this without moving your head. Looks good. Accommodations in your 6 fields, cardinal fields of gaze. Okay. I don't see any nystagmus. Looks good. And your eyes, they look clear, white, sclera, and I'm going to check conjunctiva. Looks good. Pink, no signs of infection. And your nose looks good. I looked inside your mouth. Let's check your nose. Looks good. I don't see any polyps or looks clear. Okay, so now I'm going to check your carotid pulse. Okay. Pulses are regular rate and rhythm, and I would say +2, no bounding. And if I can have you swallow, no signs of tracheal deviation, and I'm gonna pinch right here a little bit for hydration check. Okay, no tenting, looks good. And can I have you lift your arms up like this, please? And I'm gonna check. Thank you for skin breakdown, looks good. If I can have you bring your arms out and up, range of motion looks good. And so I've checked those. I'm gonna check your brachial pulses on both sides. Thank you. Okay, both pulses feel regular rate and rhythm, and how your radial pulses. Looks good. I'm gonna check your blood pressure, let you know what they got for so your temperature was 98.8, which is within the normal limits, and you're not running a fever or haven't had any issues with temperature. Okay, and your blood pressure is 146/84. Your O2 saturation is 97 room air. Do you use any oxygen or any supplements? Okay. So I didn't check your ears. I'm gonna check your ears really quick. And as I leave this, they look good. Free of cerumen, no lacerations. The skin is intact and dry and clear. Pink, looks good. So my question was if you wear hearing aids or glasses.
No.
Okay, and do you go to the dentist regularly or
Yes.
get those checked? Okay, so it's good. I'm gonna ask a few more questions about diet. Do you have sorry, what kind of diet do you have? Food
I
do you
eat a lot of protein, dairy, berries, grain.
Good. Sounds like you have a well-balanced diet. And how often are you drinking water or liquids?
I drink probably about 8 glasses of water.
Perfect, that's what we recommend. And how is your voiding patterns? Are you regular? Do you have any issues?
Pretty regular.
Okay, so no incontinence or burning or frequency or just good. Sounds good. And I'm gonna have you lay back and we'll do a couple of assessments. Okay, I'm kind of jumping the gun here, but I'm gonna ask a few more questions about your bowel pattern. Do you have, how often do you use the restroom? Do you have bowel movements?
Probably about 2 to 3 times a day.
Okay, that's good. So can you describe how they look for me?
Brown and soft.
Perfect, that sounds regular. And there's no constipation or issues while you're going. Perfect. So I'm gonna listen to your apical pulse first, and that is between the 4th and 5th intercostal space, mid-clavicular line. And then I'll also inspect your abdomen. It looks pretty good right now, but I don't see any abnormalities or bulges or anything that is concerning. So I will go from your left lower quadrant to your left upper, your right upper quadrant, and then down to your left lower quadrant. And I'll listen first and then palpate lightly and then do a little bit of a deeper palpation. And if you're feeling any discomfort or pain, please let me know. And then I might also palpate your bladder. So if Steve, would you need to void before?
Yeah.
Okay, thank you. So I will start that now.
Okay.
So apical pulse first. Okay, so I would listen for a minute if there was any abnormalities. There wasn't. It sounds good. So I listened for 30 seconds. You're about 60. And I also counted your respirations and you had about 16. So that was good. Now I'm gonna listen. Okay, so you have normal, active back sounds. And if I didn't hear any, I would listen for about 5 minutes and let you sound good. So light palpation. And then a little deeper. And then your bladder, no distension and no rebound pain. Everything feels okay for you?
Yeah.
Okay. Let me help you back up. Help you sit up. And before I go any lower on you, I'm gonna listen to lung sounds. I didn't listen to that yet. So let's listen to the back and then I'll listen in the front. So each time I place this on, if I can have you do a deep breath in, and then let me know if you are feeling shortness of breath or you need to stop. Okay. And we'll move to the front. Okay. Lung sounds are clear bilaterally. I don't hear any adventitious sounds. Do you have a cough? I don't hear any wheezing or crackles. Wait, okay, so that's good. And so then no sputum or anything. Now I'm going to check your capillary refills on your hands. Cap refill looks like it's less than 3 seconds on all digits. And I've already checked your radial pulses. So I'm going to, since your wrist is hurt, I'm gonna have you do a strength chest, but don't overexert yourself, okay? Strong on both sides. And don't hurt yourself, but if I can have you press on the hands like a gas pedal, and then up, there we go. And tell me if you can feel this on both sides equally.
Yes.
Okay, sounds good. So now I'm gonna check your palpitative pulses back here. Okay, they're feel a little weak, but let's go down here to your posterior tibialis. Okay, they feel regular rate and regular rhythm, and they're both strong. And your pedal pulses, dorsal pedalis. Okay, both are regular rate and rhythm, strong. If I can have you press against my hands and then pull back and up here to your legs again on each side, okay? And on your feet with the gas pedal and then press up. Okay, so I'm gonna change my gloves. Everything looks strong on both sides. So when I listen to your respirations, I also listen to your apical pulse, but I'm going to listen for your heart sounds to make sure that those are good. Check for any abnormalities. Okay, sounds like S1 and S2 are present, and I don't hear any extra sounds. Okay, so I'm gonna have you step up, but let me help you get off, and I'm gonna have you walk towards the door, and then walk back. You look like you have a nice steady gait, no guarding. If I can have you hold on to this and near me, so I'll put you forward and back, and then if you bend, good. Forward, back, bend. Okay, and I believe this is the end. Do you have any questions?
No.
Okay. Alright, sounds good. Thank you. I'll talk to the doctor and we'll let you know what he decides.
Sounds good.
Thank you.